Dear medicos, this is type 2 hypersensitivity lecture of pathology for MBBS and BDS first year. Now let's begin type 2 hypersensitivity with definition. Type 2 hypersensitivity is mediated by antibodies directed towards antigen present on the surface of cells or other tissue components. These antigens may be intrinsic to cell membrane or exogenous antigens absorbed on the cell surface, example a drug or metabolite. Reaction occurs when antibodies bind to normal or altered cell surface antigen. Now its mechanism. 4 mechanisms here are total. First one is opsonization and phagocytosis. Second one, antibody-dependent cellular cytotoxicity, ADCC. Third one, complement and Fc receptor mediated inflammation. Fourth one is antibody-mediated cellular dysfunction. And first, opsonization and phagocytosis. This is direct lysis and opsonization mechanism. Now first one, opsonization and phagocytosis. The direct lysis, antigen and antibody reaction involving IgG and IgM antibodies, complement activation, formation of membrane attack complex, lysis of target cell, example destruction of thin-walled bacteria like Neisseria. This is the direct lysis type. And opsonization, antigen antibody reaction, complement activation. 2 steps are same steps, and in the opsonization mechanism, opsonin are generated. C3b and C4b are opsonin. Opsonization of antibody bound target cells and destruction of phagocytes via C3b receptors. This is the total process of opsonization. Now antibody-dependent cellular cytotoxicity mechanism. ADCC involves cell lysis without phagocytosis mediated by monocytes, neutrophils and natural killer cells. Examples, transfusion reactions, autoimmune hemolytic anemia, erythroblastosis fetalis, agranulocytosis, thrombocytopenia and drug reactions. Mechanism, antibody binds to target cells. Recruitment of leukocytes, minimum or no activation of complement. Activation of monocytes, neutrophils and natural killer cells which bind to target cells via receptors for Fc fragment of immunoglobulin G. Cell lysis by perforins without phagocytosis. Third mechanism, complement and Fc receptor mediated inflammation. Deposition of antibody in extracellular tissue initiates an antigen-antibody reaction leading to complement activation. Complement activates inflammatory cells to cause cell injury. Example, parasitic infection and tumors. Mechanism, deposition of antibody in extracellular tissue, example ECM. Activation of complement, generation of C3a, C5a which recruit neutrophils and monocytes. Inflammatory cells bind to deposited antibodies via their Fc receptors, activation of leukocytes, release of enzymes and free radicals, and finally tissue damage. Antibody-mediated cellular dysfunction. Antibodies against cell surface receptors deregulate function without causing cell injury or inflammation. Example, myasthenia gravis, which is due to antibodies against acetylcholine receptors in the motor in plates of skeletal muscle. These antibodies impair neuromuscular transmission and cause muscle weakness. Pemphigus vulgaris, which is due to antibodies against desmosomes. These antibodies disrupt the intracellular junction and result in the formation of vesicles.